Martin was on a day out with his biking mate Paul. When they had to brake hard, their two bikes collided.
Came over the hill.
Yeah.
Queue station traffic like this, jumped on the brakes, locked up my back wheel. He was in front of me. I tried to go around him, caught him with the back quarter of my bike.
So it was relatively low speed?
Well, we were doing about national speed limits we came over.
I'd say steady away about 60 or something like that. We weren't going silly around.
Martin is talking and breathing unaided, but after such an impact, his spine could be badly damaged.
Motorbikes are always going to be dangerous, but you can build in safety by the use of proper protective personal equipment, making sure you've got a good helmet that fits. The other big innovation recently is the full body armour and spinal plate, and these really do reduce the incidence of spinal injuries on motorcycles.
Luckily, Martin was wearing good protection.
The back protector you've got on? Yes. Yeah, never go out without it, even down to track.
We can have all hands on, please.
But Victoria discovers an area of concern.
Pain
Where's it?
In chest, down.
Down here?
Yeah.
You can't get that arm in? Just to bring your elbow up a little bit off the ground.
The sore area is where Martin's spleen is. If that's bleeding, there's a risk of internal rupture, and that can kill.
Got a 25-year-old male coming into you, complaining of extreme pain over his spleen. We'll be with you in 20 minutes.
What we need to do with this guy is just scan him just to make sure there isn't anything internally going on. I have seen people walk away from accidents just with a bit of a dull ache in the left upper quadrant and not wake up the next day.
The sooner Martin gets to hospital, the better. Back at University Hospital, Dr. Nasir Ali is on duty in A&E. A St John's ambulance children's department with 2-year-old Cameron MacDonald and his parents. Cameron broke his leg while the family were on holiday in Spain.
We were in holiday in Samo. Cameron here slipped at the pool, managed to fracture his femur, so we then went home to the local hospital. Obviously he was totally distressed and they kept splitting us up because they would only have one adult with him at any time.
I must have cried for like 6 hours solid, just seeing him in so much pain, you know, and it took them a good 20 minutes, half an hour to administer pain relief because they wanted to check all the insurance details and everything.
It was rather bewildering. We were just ushered from place to place, and sometimes it could be horrifying not really knowing what's going on. He was screaming in agony, and of course we weren't even allowed to be near him.
I've never been so relieved to be back in the UK, I tell you.
Hello, it's Cameron. Hello there, mate. My name's Nasty, you gonna shake my hand? No? You got a poorly leg? Do you know where you broke it? This, eh?
Yeah.
About there.
About there, okay. So, and what did they do for him over there in Spain?
Gave him some pain relief and then put him on traction for a week.
And did he not have any plaster cast on, or was it?
No, the plaster cast was put on yesterday morning, so allow us to fly today.
Fly, and they put a cut down the middle.
Yeah,
okay. So we'll send him for our own X-rays, and then we'll take it from there. We'll see if we can get you home, I think. All right, okay. We'll get you to X-ray now, young man. All right. Do you want to come alongside him?
The air ambulance is landing with patient Martin Dye, who needs urgent emergency attention.
This is Martin. He's a 25-year-old motorcyclist. Came off his motorcycle at approximately 60 miles an hour. Query loss of consciousness at the time. He's got pain in the left bottom quadrant of his chest, radiating into his abdomen with guarding at the right upper quadrant. Pelvis intact, long bones intact. Just query this abdomen that he's guarding in.
Thank you. Any pain in your legs at all, sir?
Senior A&E doctor Mohammed El Sagir takes charge of the assessment of Martin's injuries.
Is that sore?
Yeah, it's my chest.
Hurting in your chest?
Yeah.
Are you sore there?
Yeah.
There?
Dr. El Sagir locates the painful area. If untreated, internal abdominal bleeding can be fatal.
We are a little bit concerned about your belly, mainly. Because of the mechanism of the injury itself, we just have to scan the rest of you.
With a scale of 1 to 10, how much is your pain?
I'd say at least sort of 7.
7?
Yeah.
Have some pain relief.
Martin is given pain-relieving drugs to help him cope, as he is wheeled to the CT scanner next door.
It's quite a common thing with motorcyclists when they come off the bike. Sometimes they injure their organs. He also have a high heartbeat, which could be explained that he's losing blood, and that might be because of the internal injuries.
After breaking his leg on holiday in Spain, 2-year-old Cameron came straight from the airport to A&E for a checkup. His leg has been x-rayed and Dr. Ali has the results.
This is Cameron's x-ray, and you can see clearly where the fracture is. Ideally, you'd like them as close as possible, but the orthopedic doctors have been down, had a look at the x-rays, and they believe that that's probably adequate positioning, and because Cameron's so young, he'll remodel that and he'll heal quite well.
Cameron will have to have his plaster cast on for another 6 weeks, but the staff of A&E have done their best to make it easier.
Basically, the cast was set up in Spain. It wasn't particularly comfortable, so what the nurses have done have made it more comfortable and waterproof so that he can do his business and not wash the cast away.
Now that he's comfortable, because she's like pulled it all away so it's not digging into him here, we just need to like bath him with flannel and everything. And he's going to head home and watch some Thomas the Tank and have spaghetti and toast. He's a little fighter, so I think he'll be all right, won't he?
Cameron's leg will take several weeks to heal completely, but he's already back at his nursery and playing with his pals. Doctors are concerned that bike crash victim Martin Dye may have internal bleeding. The CT scanner will show if this is true or not. It's a great aid to emergency diagnosis.
Life is a lot easier for us than it used to be many years ago, because before we used to have to struggle mentally to work out what's wrong with the patients, unless it's something pretty obvious. But now we have our own scanning machine, so basically if we suspect something, we just scan the patient straight away.
And thanks to the scanner, Dr. El Sagir has good news for Martin.
Right, your scan is fine.
Yeah.
So we're not concerned about any injury to your belly.
Yeah.
So what we're going to do now, we're going to take off all this,
Magic.
and then we'll sit you up, and then we'll take it from there.
Yeah.
Okay.
My right knee's hurting quite a bit.
I'll have a look at that, because they always have little bits that starts coming off. Once the big bits, you know, stops hurting, then you start feeling different. Can you turn your head towards me? Is that okay?
Yeah.
Turn your head the outside. Is that comfortable?
Yeah, it's fine.
Where is your pain now? Your knee? Can you bend your knee at all? That's good.
It's quite painful moving up then.
Right, where?
Just in the...
Just on the side there? Okay.
Right in the centre of the kneecap.
Right, we'll get some x-rays and then I'll see you later. Then.
Okay,
All right.
thank you.
Thanks. So we send him for an x-ray on his knee and his left hand, and both of them are no bony injury. So in other words, he was just bruised. But obviously he's fortunate that he's come out of it reasonably unscathed. And he's actually immobilised at the moment. Where is hurting? Back, yeah.
Yeah, down there.
Yeah.
The ribs and... I think it was just getting the sat up that...
That's fine. And your knee?
It's aching, but it's okay with the weight on.
Perfect. So you're going...
Yes.
Okay. As you've seen, he's just mobilised. He's aching, which you're bound to feel if you hurt yourself. But apart from that, he's capable to move.
Martin's pain turns out to be simple bruising. It could have been a lot worse, and he knows he's been lucky.
Still a lot of aching along this side of my rib cage, and I think I can put the lack of that any worse down to the back protector I was wearing. Probably the best money I've spent in a long time. Nothing's broken, nothing's damaged, so lucky escape.
Coming up, horse lover Suzanne McLeod is kicked on the head by a hoof.
It's a really deep wound, so it's that long.
And toddler Scott's simple blisters turn into a dangerous problem.
I'm not happy with those blisters. They're infected.